Welcome friends! I'm Dr. Rajsree Nambudripad, and today's video is all about fibromyalgia and chronic fatigue syndrome. Fibromyalgia is a condition of widespread pain. Remember the muscle soreness that you get after a flu shot? Now imagine that ache throughout your whole body, along with profound fatigue and mental fog. That's how miserable it can be to have fibromyalgia, which affects 5 million adults in the United States, or up to 4% of the population, and it affects women much more commonly than men. When we break down the word fibromyalgia, it comes from fibro, which means fibrous tissue in Latin, myo, which means muscle in Greek, and algia, which means pain in Greek. Here we have my patient Sofia, who initially went to her primary care doctor and asked why she was always in pain. Unfortunately, her doctor told her that all her tests were normal and that there really wasn't anything wrong with her based on her tests. This is why a lot of people with fibromyalgia remain undiagnosed. In today's video, we're going to dispel the myth that these symptoms are all in your head, and we're going to go over the root causes of fibromyalgia and how to treat it through a holistic approach. One of the hallmark features of fibromyalgia is central sensitization. This means that the brain is in a persistent state of heightened reactivity, and there's amplification of sensory signals by the brain. This hyperexcitation of pain-sensing neurons in the brain leads to hyperalgesia, which means an increased sensitivity to pain. It can also cause allodynia. This is where a stimulus that normally does not cause pain, like a light feather touch, actually causes pain in these individuals. In the spinal cord, there's higher levels of substance P in the cerebrospinal fluid. This is a neuropeptide that also mediates pain pathways. Because of the central sensitization, any type of pain gets amplified. For example, if a person has osteoarthritis in their knee, the pain can become more widespread, severe, and debilitating. Or if the person has diabetic neuropathy, that pain can also get amplified. Fibromyalgia can cause many different types of pain. For example, it can cause flu-like aching, muscle tenderness, or an all-over body hypersensitivity. Another hallmark of fibromyalgia is sleep disturbances. Their sleep quality is really poor and non-restorative, and their body becomes deprived of deep sleep. As a result, fatigue is another big symptom seen in fibromyalgia, and there's a lot of overlap with chronic fatigue syndrome, which I'll also be explaining today. Many patients with fibromyalgia feel exhausted all the time. Another common symptom is brain fog, which can cause poor concentration, memory problems, as well as impaired mental processing. We often refer to this as fibrofog. In addition to all the physical symptoms, fatigue, and fibrofog, there's often also mood symptoms, like depression and anxiety. Finally, fibromyalgia patients can also experience paresthesias. This is a feeling of numbness or tingling, or pins and needles feelings in the arms or legs. One of the difficulties is that getting a diagnosis of fibromyalgia can sometimes be challenging because all of the tests come back normal. So the blood tests will show that the patient is not anemic, has normal thyroid function, and has normal standard inflammation markers, like the ESR, which is the SED rate, as well as the CRP. In addition, when we do imaging tests on parts of the body that are in pain, like X-rays or MRIs, they also come back normal. So it can be helpful to consult with a rheumatologist, which is the type of specialist that's more familiar with fibromyalgia. In fibromyalgia, the inflammation that's causing the pain is often hidden. For example, there could be dysbiosis, which is a bacterial imbalance, or inflammation in the gut, and we're going to talk more about this later in this video. Research studies show that there is elevation in certain inflammation markers, like cytokines, TNF-alpha, and interleukins. But unfortunately, the standard inflammation markers that are done in the clinical setting, like the ESR and CRP, are generally normal. Going back to my patient Sofia, she continued to have a lot of pain, so she consulted with a rheumatologist. The rheumatologist reviewed all of her symptoms and diagnosed her with fibromyalgia. Sofia was relieved to finally have a diagnosis that explained all of her symptoms. So what are the criteria to make a diagnosis of fibromyalgia? The original criteria were made in 1990 by the American College of Rheumatology. In this diagram, each of the red dots represents a potential tender point. If a person had pain when pressure was applied to at least 11 of these 18 tender points, this would qualify as a diagnosis of fibromyalgia. In 2010, the American College of Rheumatology revised the diagnostic criteria. Now the diagnosis is made based on symptoms, using the Widespread Pain Index and the Symptom Severity Scale. This includes having widespread pain in specific areas of the body, having moderate to severe fatigue, waking unrefreshed from sleep, and noticing cognitive dysfunction. The symptoms need to be present for over 3 months, and there can be no other disorder that would otherwise explain the pain. It's important to remember that every patient with fibromyalgia is unique, and the disease affects everyone differently. Studies that have been done on identical twins show that 50% of the disease is genetic, while the other 50% is determined by the environment. Unfortunately, there's no clear genetic testing because there's no single gene or even cluster of genes that can predict if a person will develop fibromyalgia. The biggest question is, what is the root cause of fibromyalgia? Trauma appears to have a big role in triggering fibromyalgia. Trauma is when a person experiences something too much, too fast, or too soon without the capacity to cope with it. It could be physical, emotional, or sexual abuse that triggers a chronic stress response. This changes the nervous system and causes a state of sympathetic overdrive, which is like a fight or flight response. The brain becomes perpetually alert, which causes a lot of micro-awakenings and prevents deep sleep. This leads to significant muscle tension. When muscles are constantly tense, they produce higher levels of lactic acid. So in a sense, nonstop muscle tension is equivalent to nonstop exercise. In addition, this chronic stress response is what causes the central sensitization and the amplification of pain signals by the brain. The lack of deep sleep is one of the fundamental driving factors in fibromyalgia. Not only does it contribute to the chronic fatigue and fibrofog, but it also results in a lower production of growth hormone. This ongoing deprivation of deep sleep also impairs the body's ability to heal. There's a big overlap between fibromyalgia and chronic fatigue syndrome. In fact, 60 to 70% of fibromyalgia patients also have chronic fatigue syndrome. Research suggests that fibromyalgia and chronic fatigue syndrome are related. There's an underlying central nervous system mechanism in both conditions, and they both have symptoms of fatigue and brain fog. The hallmark of chronic fatigue syndrome is severe exhaustion that's not brought on by exertion and not relieved by rest. We've already talked about the root cause of fibromyalgia often being trauma, but what is the root cause of chronic fatigue syndrome? Chronic fatigue syndrome is thought to be triggered by a viral infection, like the Epstein-Barr virus, which causes mononucleosis, or even the COVID virus. It's caused by a dysfunctional immune system that has a lingering response towards the virus. In chronic fatigue syndrome, we often see symptoms related to the immune response, like swollen lymph nodes, recurrent sore throats, or recurrent low-grade fevers. Let's look more closely at the differences between fibromyalgia and chronic fatigue syndrome. Fibromyalgia often begins with a gradual onset of symptoms, whereas chronic fatigue syndrome often begins with a sudden onset of flu-like symptoms. Fibromyalgia is often related to trauma, unlike chronic fatigue syndrome. In fibromyalgia, we see muscle pain and stiffness, whereas in chronic fatigue syndrome, we see symptoms like sore throats, swollen lymph nodes, and low-grade fevers. Growth hormone levels are low in fibromyalgia, but normal in chronic fatigue syndrome. Remember the elevated substance P that's found in the cerebrospinal fluid of patients with fibromyalgia? The substance P level is normal in patients with chronic fatigue syndrome. Finally, fibromyalgia patients see improvement with medications that induce deep sleep. This is not the case in chronic fatigue syndrome. Fibromyalgia and chronic fatigue syndrome do have something in common, and that is mitochondrial dysfunction. The mitochondria, which are the energy powerhouses of the cells, don't make as much ATP, which is the energy currency of the cells. This is why supplements like CoQ10 and electrolyte powder with ribose can be really helpful to support the mitochondria and improve energy levels. A lot of patients with fibromyalgia also suffer from autonomic dysfunction. For example, they can feel lightheaded upon standing, which we call orthostatic hypotension. Normally, when you stand up, your nervous system constricts the blood vessels in your legs to prevent a drop in blood pressure. But in fibromyalgia, the nerves are already on overdrive, so they can't send the signal to the blood vessels to constrict, and this can cause the low blood pressure and dizziness upon standing. Once again, drinking water with electrolyte powder, which has all the minerals like sodium, potassium, chloride, and magnesium, can really help with these symptoms. Now let's shift gears and talk more about the gut, because there's a big overlap between fibromyalgia, chronic fatigue syndrome, and irritable bowel syndrome, or IBS. In fibromyalgia, because the nervous system is stuck in that chronic stress response, we see higher levels of cortisol, which is the stress hormone made by the adrenal glands. Chronic elevation of cortisol can alter the permeability of the small intestine lining, leading to leaky gut. It can also cause the overgrowth of bad bacteria in the gut, which we call dysbiosis, as well as yeast like Candida. The high cortisol levels also suppress the vagus nerve. This slows the motility throughout the intestines and can lead to an overgrowth of bacteria in the small intestine. This is called small intestine bacterial overgrowth, or SIBO. What's fascinating is research shows that the gut microbiome of patients with fibromyalgia have more bacteria that use up tryptophan, which is the amino acid found in certain foods like turkey. Normally, tryptophan is the precursor that's needed to make serotonin, which is the happy brain neurotransmitter, as well as melatonin, which is important for deep sleep. So the gut microbiome is contributing to the lower levels of serotonin and melatonin that's seen in fibromyalgia. In addition, research shows that patients with fibromyalgia have reduced gut microbiome diversity and reduced levels of a good bacteria called bifidobacterium. To learn more about how to heal the gut, I have a whole playlist of videos, including my video on leaky gut, my herbal protocol for SIBO, as well as on Candida and SIFO, and I'll share the links in the description below. Stealth infections need to be addressed because they can exacerbate fibromyalgia as well as chronic fatigue syndrome. This includes chronic sinusitis, chronic vaginitis, fungal infections, exposure to mold and mycotoxins, Lyme disease, as well as long COVID. Exposure to heavy metals and other toxins can also be a contributing factor that can worsen symptoms of fibromyalgia as well as chronic fatigue syndrome. Please watch my video on detoxification, which I'll link below, where you can learn ways to avoid and eliminate these toxins from your body. I also review supplements that can be helpful in detoxifying, like glutathione and zeolite binder. Over 70% of patients with fibromyalgia and chronic fatigue syndrome have a dysfunctional MTHFR gene. It stands for methyl tetrahydrofolate reductase, and it controls a process called methylation, which is a form of detoxification that happens in every cell of our body. This is also why these patients are more likely to suffer from depression. This is also why supplementing with methyl B complex or methylation support can make a big difference in energy as well as mood. To learn more about the MTHFR gene, please watch my video and I'll share a link in the description below. A lot of patients with fibromyalgia as well as chronic fatigue syndrome have a higher body mass index and suffer from a metabolic condition called insulin resistance. Insulin resistance is the physiology that can lead to type 2 diabetes, and it puts these patients at a higher risk of cardiovascular disease. If you're overweight and snore at night, it's a good idea to rule out sleep apnea by getting a sleep study done. Supplements like Berberine Pro and cinnamon and chromium can help activate insulin receptors and improve metabolism. To learn more about how to treat insulin resistance through diet and lifestyle, please watch my video, and I'll share a link in the description below. Now let's get back to my patient Sofia. She was relieved to finally have a diagnosis of fibromyalgia from the rheumatologist, but came to me and asked how she could feel better using a more natural and holistic approach. So now let's go over my treatment protocol, which really applies to both fibromyalgia as well as chronic fatigue syndrome. Here's a brief overview of the protocol. We start by cleaning up the diet, introducing key supplements, and healing the gut. Next, we work to calm the sympathetic nervous system, improve deep sleep, and support the adrenals and thyroid gland. Finally, therapeutic movement, complementary modalities, and lifestyle changes can also make a big difference. When it comes to the diet, the first step is to cut out the big inflammatory trifecta, which is gluten, dairy, and sugar. It's also good to avoid alcohol and excess caffeine, which can interfere with sleep. It's important to avoid all processed foods, as well as restaurant oils, which can be inflammatory. Every patient is unique, so I recommend getting an IgE food allergy test done, which is a blood test available through most standard labs. If we identify any food allergies, it's a good idea to avoid these foods to see if your symptoms improve. A randomized control trial done on fibromyalgia patients found that cutting out gluten, dairy, sugar, and ultra-processed foods for 3 months made a big difference in symptoms. Interestingly, they also went on a low FODMAP diet for the first month of the trial. This happens to be the diet used to treat small intestine bacterial overgrowth. Remember how I mentioned that SIBO is more common in fibromyalgia patients? So if you have any bloating or symptoms of IBS, it's a good idea to test for SIBO. I have a whole video that covers my herbal protocol for treating SIBO, and I'll share a link in the description below. It's really important to avoid all food additives and chemicals, like MSG, which is present in a lot of processed foods, as well as aspartame, which is the artificial sweetener present in diet sodas. Both of these are considered to be dietary excitotoxins, and many fibromyalgia patients report that their pain levels drop after cutting out all diet soda. Even if you don't have any allergies on your blood test, it may be helpful to go on an elimination diet to figure out your food sensitivities. In addition to avoiding gluten and dairy, you can also eliminate corn, eggs, soy products, as well as nightshade vegetables like tomatoes and eggplant. After avoiding these foods for about a month and observing your symptoms, you can then try to add them back one at a time to see if they make a difference in how you feel. One diet that's excellent for lowering inflammation is the paleo diet. The paleo diet eliminates all grains, like bread, rice, pasta, and cereal. So it's basically vegetables, protein, and good fats. This diet is excellent for treating symptoms of IBS, healing leaky gut, and reversing insulin resistance. It's also important to eat organic as much as possible, as exposure to pesticides can often aggravate symptoms. Nutrient deficiencies are really common in both fibromyalgia as well as chronic fatigue syndrome. This is why I recommend some key supplements, like a quality multivitamin, methyl B complex, omega-3 fish oil, as well as vitamin D3 with K2. Essential magnesium taken at bedtime can make a huge difference in sleep quality as well as muscle recovery. Taking a nice warm Epsom salt bath is a great way to absorb magnesium through the skin. This can also help calm the nervous system, relax muscles, reduce pain, and improve sleep quality. Additional helpful supplements include CoQ10, which is an antioxidant that can help with the mitochondrial dysfunction. Electrolyte powder with ribose is a great way to stay hydrated and boost your energy throughout the day. Turmeric Pro can also be really helpful in lowering inflammation. Now that we've replenished all the key nutrients, our next focus is to heal the gut. Taking a high-quality, broad-spectrum probiotic like our probiotic 100 billion can help to improve the diversity of the gut microbiome, and it has over 5 strains of lactobacillus and bifidobacterium, which are the good bacteria for the gut. Digestive Enzyme Pro can help you to break down your food better, so it can reduce symptoms of bloating and irritable bowel syndrome. This can also help lower inflammation in the body and help you to absorb more nutrients from your food. To heal inflammation in the gut, such as leaky gut, we can use L-glutamine powder or IgG Guard, which is bovine immunoglobulins. To treat any overgrowth of bad bacteria or yeast in the gut microbiome, we can use herbal antimicrobials. The 3 most popular herbs are berberine pro, oregano oil, as well as alicidin, which comes from garlic. These 3 herbs can be used to treat a variety of gut conditions, including SIBO, CFO, which is small intestine fungal overgrowth, Candida, which is a yeast overgrowth, as well as dysbiosis, which is a bacterial imbalance in the gut. To learn more about these products, please visit my supplement store where I go into a lot more detail on how best to take these supplements, and I reference certain videos that may be helpful. The next goal is to calm the sympathetic nervous system. Helpful techniques include diaphragmatic breathing, meditation, or other mindfulness practices. Gentle exercises as well as biofeedback can also be helpful. In fibromyalgia, it's really important to address prior traumas. Some helpful modalities include therapy, counseling, or EMDR, which stands for eye movement desensitization and reprocessing. When dealing with chronic pain, it can often be helpful to learn to use conscious thought to change the pain experience. In other words, learning to acknowledge the pain, but not letting it affect how you feel. Strategies to improve sleep are of vital importance. This includes having good sleep hygiene habits, like avoiding screen time right before bed. It's also important to avoid alcohol, which can affect sleep quality, as well as any caffeine after noon. As mentioned earlier, essential magnesium taken at bedtime can really help enhance sleep quality and improve muscle recovery. If sleep quality is still not good, then sleep medications can be considered under the guidance of a qualified healthcare provider. As you may recall, in fibromyalgia, inducing deep sleep can really help improve symptoms. Next, we have to support the adrenal glands, because most people with fibromyalgia or chronic fatigue syndrome have some element of HPA axis impairment. HPA axis stands for hypothalamic pituitary adrenal axis. It's helpful to optimize your DHEA level on your blood work to 150 to 250, because this is the good adrenal hormone that helps with energy and cognitive health. Pregnenolone is the precursor to DHEA, so these 2 supplements are often taken together in the morning. Adrenal support has the adaptogenic herb called rhodiola, which can help with stress, as well as bovine adrenal gland, and B5, which is pantothenic acid. Phosphatidylserine is a phospholipid that comes from sunflower, and it can help to lower cortisol, which can improve symptoms of anxiety and insomnia. A lot of patients also benefit from thyroid support. The thyroid gland is a butterfly-shaped gland located in our neck that strongly influences our energy and metabolism. The thyroid is controlled by the brain, which produces thyroid-stimulating hormone, or TSH. The thyroid first produces T4, which has to be converted to T3, which is the active form of thyroid hormone. However, if a person's under chronic stress and has high cortisol, then the T4 gets converted by an alternative pathway to reverse T3, which is inactive in the body. We can help support the healthy conversion of T4 to T3 by supplementing with selenium. In fibromyalgia as well as chronic fatigue syndrome, it's really important to have the thyroid hormones optimized. Prescription thyroid medications that have a T3 component can often be very helpful. For example, liothyronine is a T3 medication. Medications that have both a T4 and T3 component include desiccated porcine thyroid, such as Armour thyroid, or a T4-T3 compounded medication. One of the most fundamental parts of treating fibromyalgia and chronic fatigue syndrome is to incorporate therapeutic movement. It's important to warm up the body with stretches, and low-impact exercises like walking and yoga are often preferred. Why is exercise so important? Well, first, it releases endorphins, which are the body's natural painkillers. It improves blood flow to the brain, which can help with memory and cognition. It reduces tension in the muscle fascia and helps to promote deep sleep. It also improves growth hormone production, and it helps the mitochondria to make more energy. Drinking water with electrolyte powder that has ribose can often help improve energy for exercise, and it's important to allow an adequate recovery period between sessions. It can also be helpful to explore complementary modalities like acupuncture and myofascial release therapy. NAET stands for Nambudripad's allergy elimination technique, and it's an energy medicine technique that can be really helpful at addressing physical and emotional allergies. Once these physical and emotional allergies are cleared, we often see significant improvement in the symptoms of fibromyalgia and chronic fatigue syndrome. Low-dose naltrexone is a medication that's been research-proven to reduce pain in fibromyalgia. Normally, naltrexone is a medication that blocks opioid receptors, but at low doses, it actually calms glial cells and reduces neuroinflammation. It may also upregulate endorphins. Generally, low-dose naltrexone is well tolerated, and its only side effect is possible vivid dreams. To prevent vivid dreams, it can also be taken in the morning. For those suffering from severe pain in certain areas of the body, trigger point injections can also offer relief. This is where a numbing medication is injected into the muscle to break up the knots in the tissue. This is a procedure that's generally done by pain management specialists. Finally, lifestyle changes like spending more time outdoors can also be very healing, because a lot of patients with fibromyalgia and chronic fatigue syndrome have sensitivity to EMF. Rather than spending the whole day in front of a computer screen, it can be helpful to go outside and connect with nature. Some patients may have more severe symptoms that require pharmaceuticals. Topical NSAIDs are preferred since they can be applied to the area of pain and won't cause any inflammation in the gut. Certain antidepressants are often used because they reduce the central sensitization in the brain. This includes SNRIs like duloxetine and venlafaxine, as well as tricyclic antidepressants like amitriptyline. Other medications that can help manage pain include anticonvulsants like pregabalin as well as gabapentin. But these medications are sedating, so they're best taken at bedtime. Returning to my patient Sofia, she had symptoms of fibromyalgia since the age of 28, but she finally got a diagnosis at the age of 32. After her diagnosis, Sofia came to see me, and I helped her to clean up her diet and started her on some key nutritional supplements like methyl B complex, omega-3 fish oil, vitamin D, and magnesium. I helped her to heal her SIBO and leaky gut with a round of herbal antimicrobials, probiotics, and L-glutamine powder. I gave her adrenal support as well as phosphatidylserine to lower her cortisol levels, and this really helped her sleep as well as anxiety. She also incorporated regular yoga and walking. After just 6 months of treatment, Sofia was like a different person. She had made significant progress on her healing journey and was able to reclaim her life. So here are the key points. Trauma can be a big root cause of fibromyalgia, which is characterized by central sensitization, which is the amplification of sensory signals by the brain. There's a big overlap between fibromyalgia and chronic fatigue syndrome, but chronic fatigue syndrome usually has a viral trigger. Both conditions are clinical diagnoses that are made based on symptoms. Fatigue, brain fog, and mood symptoms are seen in both conditions. A lot of these patients also have IBS because of problems in the gut microbiome. We also see a lack of quality deep sleep in both conditions. Cleaning up the diet as well as optimizing nutritional status with key supplements can make a big difference. Healing the gut and introducing regular therapeutic movement can be incredibly helpful. Finally, there are many complementary modalities that can also help in improving symptoms. Sofia is just one of many patients I have seen who have experienced incredible success and have been able to turn their life around using this approach. Thanks so much for watching, everyone. If you enjoyed the video, please give it a thumbs up and subscribe to my channel. Please post all your questions and comments below. I look forward to hearing from you. Thank you again and have a wonderful day.